Attention Deficit Hyperactivity Disorder, or ADHD, by Catherine Bentley for Dr. Valerie Zelenka, July 13th, 2025. We'll start off with what is ADHD. ADHD is a high-incidence special need. It is not considered a learning disability. It is diagnosed when an individual has chronic and serious inattentiveness, hyperactivity, and/or impulsivity that is more severe and occurs more frequently than in peers. It is most often a lifelong condition, and behaviors may change, but ADHD is often present throughout an individual's life. 50% of ADHD children will lose ADHD symptoms into adulthood. If symptoms do not disappear entirely, oftentimes symptoms of ADHD can also change throughout an individual's life. The high mobility, sometimes obnoxious behaviors in these children can lead them to have difficulty in making or maintaining friendships, and sometimes their peers will see them as immature. It is also important to know that many children with ADHD will have a Section 504 plan, while other children, and these are going to be those children with the most severe symptoms or those with other learning disabilities, may have an IEP, and these documents will be good sources for learning how to assist these children. Students with ADHD can be diagnosed and placed into one of three categories based on the symptoms they present with for ADHD. And these presentations include ADHD predominantly inattentive type, ADHD predominantly hyperactive impulsive type, and ADHD combined type. Along with the presentation type, a severity level is also included in diagnosis. The severity level is given by the number of symptoms present past the required number to be diagnosed with ADHD, and these severity levels include mild, moderate, and severe. ADHD behaviors can also be isolated into the type of ADHD that it presents as. So making careless mistakes, being easily distracted, and appearing not to listen kind of align with the inattention part of ADHD. Fidgeting and the inability to stay seated align with the hyperactivity center of ADHD, and blurting out answers and difficulty waiting for a turn or interrupting conversations aligns mostly with the impulsivity section of ADHD. And this is a good list, but the list is not entirely comprehensive, and other symptoms may be present in students with ADHD. Anything that presents as an inability to focus, sit still, or refrain from acting out can be a symptom of ADHD. Let's talk about ADHD prevalence and the causes of ADHD. ADHD occurs in 5 to 11% of children between the ages 4 through 17, and that estimates to be around 6.4 million children. It occurs almost 3 times as often in boys than it does girls, and it frequently occurs with other disabilities, like learning and behavioral learning disabilities. White children are more commonly diagnosed, and Black students diagnosed less frequently, and if they're diagnosed, may not take necessary prescriptions. What causes ADHD? Heredity is the largest factor in ADHD. It tends to run in families. Smoking and drinking in pregnancy may be a factor in ADHD. And there are some suggestions that food additives and allergies, inner ear problems, vitamin deficiencies, and bacterial infections may be causes of ADHD. According to Friends, there is no evidence of any of these being a true cause of ADHD. However, according to many sources, these things can worsen symptoms in ADHD people, and still other sources also may recommend that a low-sugar, balanced diet, limiting TV time, participating in physical activity, and getting adequate sleep can lessen symptoms and act as a natural remedy. What do the behavioral interventions look like in students with ADHD? There are many behavior intervention options. These include emphasizing structure and rewards in the classroom. As stated, children with ADHD may have worsened symptoms with excess sugar, so try to base rewards on an activity or topic-related object instead of something like candy. Minimize reprimands and consequences. As with any other student, reprimanding and dealing in consequences should be a last priority. And whenever we do reprimand, try to use positive reinforcement rather than negative reinforcement. Consider the environmental demands of students with ADHD. Be mindful that the environment ADHD children are in may be a cause for their acting out or distraction, and sometimes all that needs to happen for behavioral interventions is to alter the environment to lessen distractions. And whenever we're speaking with these children, be sure to use clear and concise corrections. When these children do need reprimanded, remain patient and be sure to use positive, clear language. Harry, put the ball down and sit back down in your assigned seat, as opposed to Harry, don't touch that and get back in your seat. Be very, very clear. Parent education in students with ADHD. As stated by friends, parent education is rarely solely the teacher's job. However, as a teacher, it is important for parents to be informed on how their children are doing in class. And just like any other students, focus on strengths rather than their weaknesses and stay positive. Parents should also be aware of the reward system used in class, as it may help for the same reward system to be used in class and at home. And parent education can incorporate information for parents to respond to child behavior at home and even in community settings. And having parent education also builds collaboration between the school and the home. Teachers can also suggest that ADHD parents attend sessions to learn about responses to behavior, discipline systems, creating social life. And again, some of these ADHD students will really suffer in their social life because sometimes they have a hard time making friends. Skills for collaborating with professionals, and student rights after high school completion. Student rights after high school completion is going to be a top priority for students who are in later high schools as they start to transition out of high school. Medication in students with ADHD. Medication is the most common intervention. 70% of 6 million identified ADHD students use medication, and it's considered 70% effective. Medications include stimulants, antidepressants, and hypersensitives, including Adderall, Dexedrine, Vivance, Concerta, Ritalin, Fogalin, Strattera. The list goes on and on. ADHD medication is still considered controversial, even though it's very effective, due to the fact that some teachers have caught ADHD students sharing their prescriptions, and students do not always regularly take their prescriptions. Some side effects exist, such as weight and height gain, although this often resolves itself with time, according to research. And some also believe that ADHD prescription use could be a gateway drug to other illicits in adulthood. Oftentimes, the way students will react to new medications is not known, so a bit of waiting to see is involved. And as a teacher, we need to know the prescribed medications, alert nurses and parents to changes in learning and behavior, and respond to parental medical inquiries. Academic interventions for students with ADHD. Well, these students cannot focus for very long at all, so these students with ADHD typically struggle in school. To help with this, we can implement the include in instruction by emphasizing essential information, really focus on what needs to be done today and how it needs to be done. Break longer assignments into smaller parts, especially if it's an essay, have a student write the introduction and then do one of the body paragraphs, so on and so forth. Give extra time for computational work. If there's a lot of math involved, then give the student extra time to make sure it's all complete and correct. And keep the pace perky and provide student participation opportunities in the class. There are things that can be done prior, during, and in concluding instruction that can help students with ADHD focus and get the most out of their learning. Before lessons, provide advanced organizers, review previous lessons, and state needed materials. During a given lesson, be predictable, support participation, and use audio-visual materials. In concluding a lesson, provide advanced warnings, check assignments, and review the next lesson. There are also technological apps available to help students with ADHD, such as iStudies Pro, Evernote, Google Keep, Google Inbox, 3030 Task Timer, and Studious. And these apps can allow students to keep organized, help utilize the time that they have, and take necessary notes. Environmental supports in students with ADHD. Make sure the classroom is as free from distraction as possible. Avoid having an abundance of distracting posters or spinning hanging decorations. If you listen to music in class, it may be necessary to skip it or turn it down, or try to listen to something like instrumental or orchestral music to avoid further distraction. Provide very clear classroom routines and rules, and stick to them. Permit variety in activity and instruction. You might lecture one day, but be sure to engage these students on hands-on and inquiry work. Alert students to changes in the routine ahead of time. And if a child is struggling with any changes, assign a peer partner to assist ADHD students. Families of students with ADHD. Having children with ADHD affects family function, adds stress to parents and siblings. Do not blame parents for students' ADHD. Do not condone negative behaviors. Students with ADHD are more prone to depression and poor self-image, may be prone to alcohol and tobacco use. And students with ADHD more likely to have conflicts with teachers and parents and authority figures. Some parents may say that the behaviors their children are committing are something that they cannot help. They have ADHD. That is the wrong outlook to have on that. As a teacher, help parents identify problem behaviors and find solutions. And as a teacher, keep an eye on these students to be ready and able to help if any signs of depression or drug use become evident. And here are my sources. I hope everyone learned a little bit of a little something about ADHD and that they can find this presentation useful.